Did you know that prostate enlargement is one of the most common health conditions to affect men? It's true, and most men will experience BPH, or an enlarged prostate, at some point in their life. Usually this condition affects men as they get older, but it can really hit you at any point in your life regardless of age. There is still so much we do not know about BPH, but years of hard work and solid data have given us a decent idea about what really causes prostate enlargement. What is the real cause of prostate enlargement? Stick around to find out, because we are going to break it down in detail right now. Part 1. Hormonal imbalances. While the cause of prostate enlargement is still debated amongst researchers, a big reason for it seems to do with hormonal imbalances, specifically when your testosterone levels drop and your estrogen levels rise. As men get older, their supply of testosterone begins to dwindle, and this can lead to some issues with your prostate. As your testosterone levels fall, the balance between estrogen and testosterone shifts, and this can be further intensified by eating foods containing more estrogen. In fact, some doctors have come as far as to infer that eating foods with more estrogen can actually put you more at risk of prostate enlargement, especially as you begin to get on in years. This balance shifting can cause your prostate to grow, and a lot of men find it difficult to halt this chain of events. Keeping a healthy relationship between your sex hormones is important, as otherwise your body can feel like it's pretty out of sorts. The only time that our hormone levels are really in flux is during our adolescence, which is also a period of transition and change. When it comes to now, however, this change is more the result of diet and exercise than it is about growing up, and it can feel even more awkward as a result. High estrogen levels can result in both physical changes as well as mental and emotional ones, meaning that it can be a pretty serious circumstance. Luckily, there are a whole bunch of ways that you can regulate your hormone levels, and it isn't a permanent situation in any way. So, if it seems like high estrogen levels are a major cause of prostate enlargement, then it would make sense to try to keep those estrogen levels as low as possible. Let's take a look at how to make that possible. Part 2. Keeping estrogen levels down. Keeping your estrogen levels low is a bit of a full-time job and requires more than just a simple change or two. Lifestyle changes involving diet and exercise can help to keep your testosterone on top. But perhaps the most important change revolves around alcohol. If you are drinking regularly, you may be costing yourself a healthy prostate down the line, as drinking can definitely contribute to prostate enlargement. Drinking alcohol over the length of years can cause your estrogen levels to rise over that period of time. And at that point, it can become very difficult to keep your prostate small and healthy. Alcohol consumption holds no real benefit, either mentally or physically. So it's an easy habit to try to cut out of your life, and one that could help you live a much longer and happier life too. Alcohol isn't the only thing that you should be vigilant of, however, as there is also estrogen found in the foods we eat every day. Consuming a lot of red meat, sugars, dairy, and refined grains can all result in your estrogen levels climbing to unhealthy amounts, and putting your prostate in quite a bit of danger too. Cutting out red meat and sweets is a hard but beneficial undertaking. And if you're struggling with it, then you may want to consider looking at replacement ingredients like soy to help with the transition period. Part 3. Identifying the problem. Most researchers believe that it takes years for the effects of high estrogen to make an impact on your prostate, so it's more important to look at trends rather than individual moments. There are symptoms of high estrogen in men that you can look for if you are concerned, but just being mindful of these can help you identify the problem as soon as it presents itself. Men with high levels of estrogen usually experience breast tissue changing from what they are used to. They may begin to notice sagging, or that their muscles sit differently than normal, and this is usually a result of a spike in estrogen. Another common symptom has to do with body hair, or rather the lack of it. When men begin to shift from being testosterone dominant to estrogen dominant, they may start to lose hair on their calves or even their forearms. Their voice may also begin to shift up an octave or so, which is usually when most men begin to realize that something is up. The last and most serious symptom that your estrogen levels are too high, though, is that your prostate will begin to grow, which usually results in the person developing BPH. It is pretty unlikely that you would get BPH in your 20s or even 30s. But if your testosterone levels fluctuate enough, it isn't out of the question either. Like we said earlier, the world is still trying to figure out everything about BPH, but there is still a lot that we don't have concrete proof of. Identifying the issue is huge, and most people discover an imbalance between their testosterone and estrogen levels through observing these physical differences. But what do you do once you've discovered something's wrong? Well, that's what we are going to talk about now, as getting things back to normal is even more important than figuring out something is off. Part 5. Getting things back on track. Once people start to figure out exactly what is going on with them, they can have a tendency to panic a bit, but this is completely unnecessary. Changes are scary, but thankfully these are almost completely reversible. Your voice will return to normal, and the hair on your calves will come back too. Everything can be fixed, but it will require that you commit to the changes we detailed earlier. People who suffer from prostate issues are usually dealing with a hormonal imbalance, and one that they probably want to deal with right away. Staying away from problem foods and getting more exercise will definitely help, but there are even more ways to help rebalance things a bit. Stinging nettle root, usually brewed into a warm beverage such as tea, is supposedly great for treating prostate enlargement. Stinging nettle root tea has done really well in the limited animal testing that it has gone through so far. And the most encouraging piece of evidence that the tea is good for BPH came from a 2015 study. The study in question found that when rats were given nettle root tea for just 6 weeks, the effects of BPH on them all but disappeared. There is a lot we still don't know about the tea, but it's shown some of the most promising signs that it can help treat BPH and not just prostate cancer, like many of the other prostate remedies. A good drink to avoid if you want to help out your prostate, as we mentioned earlier, would have to be alcohol. Most doctors recommend that their prostate patients treat alcohol like it's poison, since it can cause so many immediate issues for them. If you are trying to deal with the symptoms of BPH, a good way to go about it is to add saw palmetto into your daily routine. Saw palmetto did very well in animal trials before moving on to human testing, and the results have been very solid. Saw palmetto is effective at dealing with the feelings of having to go to the bathroom that often plague prostate enlargement patients. And it also does a good job at helping people sleep through the night without feeling like they need to use the bathroom. Finally, if you are someone who struggles to begin or maintain a constant stream during urination, then saw palmetto may be able to help, and is part of the reason why so many BPH patients take it. When it comes to diet, you should be trying to get as many veggies into your system as possible. Vegetables have a lot of the vitamins and nutrients that we need to properly take care of and protect ourselves, and that includes our prostate. People who eat cruciferous vegetables like broccoli, spinach, or cauliflower have been found to be less likely to suffer from BPH symptoms than the average person. Cruciferous vegetables may even help keep an enlarged prostate out of your life for good, which is why it's probably a good idea to stock up on greens as much as possible. Part 5. The real cause. Prostate enlargement is often the result of men not having the proper hormonal balance internally. Men who have low testosterone levels and high estrogen levels are much more likely to suffer from BPH as they get older. Furthermore, men who eat diets associated with high estrogen levels are more likely to develop an enlarged prostate. And so there definitely seems to be a pretty solid link between the prostate and estrogen. It's important to restore a natural sex hormonal balance if you want to have any hopes of shrinking an enlarged prostate. And you can do this by avoiding alcohol and improving your diet with plenty of vegetables. Taking part in a healthy keto diet or introducing some intermittent fasting into your routine has also been shown to help men maintain a healthy prostate well into their later years. Taking care of yourself, keeping an eye on any changes going on within yourself, and adjusting accordingly are all part of getting older and nothing to be ashamed of. Most men will experience BPH at some point in their lives, so it's as much about managing it as it is about preventing it. Here are 2 more videos you may find interesting. If you enjoyed this video, give it a like and share the video with your friends. And for more interesting videos on health, subscribe to the channel.